fever is a temporary rise in body temperature. It's one part of an overall response from the body's immune system. A fever is usually caused by an infection. For most children and adults, a fever may be uncomfortable, but it usually isn't a cause for concern. For infants, however, even a low fever may mean there's a serious infection. Fevers generally go away within a few days. A number of over-the-counter medications lower a fever, but you don't necessarily need to treat a fever if it's not causing discomfort. Symptoms. Body temperatures vary slightly from person to person and at different times of day. The average temperature has traditionally been defined as 98.6 Fahrenheit or 37 degrees Celsius. A temperature taken using a mouth thermometer that's 100 Fahrenheit or 37.8 degrees Celsius or higher is generally considered to be a fever. Depending on what's causing a fever, other fever signs and symptoms may include sweating, chills and shivering, headache, muscle aches, loss of appetite, irritability, dehydration, and general weakness. Taking a temperature. To take a temperature, you can choose from several types of thermometers, including oral, rectal, ear, and forehead thermometers. Oral and rectal thermometers generally provide the most accurate measurement of core body temperature. Ear or forehead thermometers, although convenient, provide less accurate temperature measurements. In infants, a rectal temperature, if doable, is somewhat more accurate. When reporting a temperature to your healthcare provider, give both the reading and the type of thermometer used. When to see a doctor. Fevers by themselves may not be a cause for alarm or a reason to see a doctor. Yet, there are some circumstances when you should seek medical advice for your baby, your child, or yourself. The causes. Typical body temperature is a balance of heat production and heat loss. An area in the brain called the hypothalamus, also known as the body's thermostat, monitors this balance. Even when you are healthy, your body temperature varies slightly throughout the day. It can be lower in the morning and higher in the late afternoon and evening. When your immune system responds to disease, the hypothalamus can set your body temperature higher. This prompts complex processes that produce more heat and restrict heat loss. The shivering you might experience is one way the body produces heat. When you wrap up in a blanket because you feel chilled, you are helping your body retain heat. Fevers below 104 Fahrenheit or 40 degrees Celsius associated with common viral infections such as the flu may help the immune system fight disease and are generally not harmful. Fever or elevated body temperatures may be caused by a viral infection, a bacterial infection, heat exhaustion, certain inflammatory conditions such as rheumatoid arthritis or inflammation of the lining of your joints, a cancerous tumor, some medications such as antibiotics and drugs used to treat high blood pressure or seizures, and some immunizations such as diphtheria, tetanus, and acellular pertussis, pneumococcal, or COVID vaccine. The complications. Children between the ages of 6 months and 5 years are at increased risk of a seizure that occurs during a fever. About a third of the children who have one febrile seizure will have another one, most commonly within the next 12 months. A febrile seizure may involve loss of consciousness, shaking of limbs on both sides of the body, eyes rolling back and the body stiffness. Although alarming for parents, the vast majority of febrile seizures cause no lasting effect. If seizure occurs, lay your child on the side or stomach on the floor or ground. Remove any sharp objects that are near your child. Loosen tight clothing. Hold your child to prevent injury. Don't place anything in your child's mouth or try to stop the seizure. Call 911 or your local emergency number if a seizure lasts more than 5 minutes or your child doesn't appear to recover well after the seizure. Get emergency room or urgent care services if it's your child's first febrile seizure. If your child doesn't need emergency care, see your child's healthcare provider as soon as possible for further evaluation. Now, to the most important part of this video, the prevention. You may be able to prevent fevers by reducing exposure to infectious diseases. Here are my best tips that can help you. 1. Get vaccinated as recommended for infectious diseases such as influenza and COVID-19. 2. Follow public health guidelines for wearing masks and social distancing. 3. Wash your hands often and teach your children to do the same, especially before eating, after using the toilet, after spending some time in a crowd or around someone who's sick, after petting animals, and during travel on public transportation. 4. Show your children how to wash their hands thoroughly, covering the front and back of each hand with soap and rinsing completely under running water. 5. Carry hand sanitizer with you for times when you don't have access to water and soap. 6. Try to avoid touching your nose, mouth or ears, as these are the main ways that viruses and bacteria can enter your body and cause infection. 7. Cover your mouth when you cough and your nose when you sneeze, and teach your children to do the same. Whenever possible, turn away from others and cough or sneeze into your elbow to avoid passing germs along to them. 8. Avoid sharing cups, water bottles, and utensils with your child or children. That's the end of today's video. If this is your first time, welcome, Akwaba. Kindly share my video to your family and friends if you find it informative. Till we meet again, take a very good care of yourself. Remember, you can also make a difference. And don't forget, Kofi loves you. Peace out.